Everyone. Our Committee on Veterans Affairs will come to order. I'm pleased to have this opportunity today to hear directly today from organizations that work with, represent, and support millions of veterans. That support millions of veterans every day. This committee is gathered here today to hear from those organizations about their firsthand perspective and their support for comprehensive suicide prevention legislation, S.785, the Commander John Scott Hannon Veterans Mental Health Care Improvement Act. This is a piece of legislation that has been before this committee and before the Senate, and I wanted to give the opportunity to those veteran service organizations and others the ability to tell us any thoughts they have in regard to this legislation as we negotiate with the House in its passage and its ability to be sent to the President. Additionally, tomorrow, September the 10th, is Worldwide Suicide Prevention Day, and this hearing is our opportunity to call attention to the tragedy of suicide impacting so many Americans and urge for swift passage of our legislation that will provide life-saving measures for veterans who are at risk. Just yesterday, I was notified of yet another veteran who died by suicide while on VA property. Despite years of increased investment in mental health care at the VA, there is a need for a new approach that places the veteran at the center of the system, that focuses on new connections and new forms of outreach. This bill achieves those goals in many ways, including bolstering outreach to veterans not yet identified and organizations that are not yet serving them, directing cutting-edge research and greater data sharing, exploring alternative suicide prevention programs, and to make certain there is no wrong door to accessing mental health care and suicide prevention services for our nation's veterans. As we know from VA data, 14 out of 20 veterans who die by suicide each day are not enrolled in the VA system. This bill will enable the VA to better work with and amplify the efforts of organizations already serving veterans across the country who are filling gaps, especially in rural and medically underserved areas. In our committee's first markup, after I became chairman in January, we reported this bill favorably with a 17-0 vote. I was pleased to work with Ranking Member Tester and our colleagues to pass this legislation out of the Senate unanimously last month. Senator Tester has been a leader in this legislation from the very beginning. While our country has faced unprecedented and unexpected challenges this year, we cannot lose focus on the need of our nation's veterans. I look forward to testimony from everyone who will be taking part in today's hearing about your organization's reasons for supporting Commander John Scott Hannon Veterans Mental Health Care Improvement Act, and your support for it becoming law, and how this bill will make meaningful impact on the lives of veterans. Let me now yield to the ranking member, Senator Tester.